Greetings, this is Mushtaq Memon, Professor Emeritus from Washington State University. Today's video focuses on impact of common animal diseases, economic losses, and zoonotic risks. So the first disease, which I like to talk about, is foot and mouth disease, or FMD, which is highly contagious viral disease of cloven-footed animals and wildlife. So all the animals which have a cloven foot, like your cattle, sheep, goats, swine, deer, and some of the other animals in the wild which have cloven-footed animals are susceptible to this. It is endemic in many parts of Asia, Africa, South America, and the Middle East, but it has been eradicated from North America and Western Europe. The last outbreak in the United States was in 1929. It disrupts the livestock production, and the big problem is that these countries with foot and mouth cannot export their animals or animal products to the countries which are foot and mouth free. So this is an embargo of the trade, which is cost billions of dollars to their countries. Now, when we talk about Western countries without foot and mouth problem, there was an outbreak in the United Kingdom in 2001, which had devastating effects. So many cows were destroyed. Now, this virus is present in urine and feces, even in semen of the affected animals, but it can enter through inhalation or in the ingestion. The severe clinical signs you would see in these animals is a fever and the lesions in mouth and the feet, which is very classical. As you can see here on the top picture on the right hand side is the mouth of a cow, which has got some lesions, blisters in the mouth. It is a profuse salivation, which you see at the bottom picture. So it's very painful. Cows cannot walk very well, so their production of milk goes down. Now, the incubation period is somewhere between 1 to 12 days. Means if the healthy animal get exposed to FMD, it may take 1 day to 12 days. Now, many of the farmers in parts of Asia and Africa know this disease very well because they have been living with this disease for a long, long time. And they know about this incubation period. They may not know the English name, but they know that if there is a farmer having, let us say, 50 cows, and 30 cows have gotten FMD. They see the animal is down and the milk is down. And then what they do is they take their hand and put in the mouth of the acutely infected animal, collect the saliva, and then put the saliva in the same hand in the healthy animal's mouth so that the animal can get the FMD quickly so that they can get it over in a short period of time rather than waiting for one cow and two cows getting FMD. So it's kind of a very interesting concept that people practice. There are vaccines available against various serotype of FMD, and I know personally that some of the even developing countries have capabilities where they're producing foot and mouth vaccine. In the United States, we have very strict regulation that if a veterinarian sees any animal with mouth lesion or in the feet, they are to report to the state and federal government veterinarians immediately, and then let them take the cultures and try to complete the whole procedure to determine if it's a foot and mouth and what next to be done. Now, there's no public, consequences. Means it's not a zoonotic disease, but a human can be what you call mechanical carrier. They can take the virus through the clothes they are wearing, the boots, and things like that. So you can see in this picture, I am in Mali, West Africa, talking to the farmers. The coveralls I'm wearing, the boots I'm wearing, They were purchased by those local organizations. Before I went to Mali, I had made a request that I would like you to provide me coveralls and boots. So once I'm done with the trip, I leave those clothes and boots in their country. I don't bring it inside the United States. Because if you travel in the United States, those of you who have done so may know that before you land in the United States, there's a form, or sometime you could fill out on your cell phone, which says that have you visited any farm? Are you bringing in animal products? Because they want to make sure that this disease does not come in the United States. The second important disease is rabies. And I'm sure most of you listening to my presentation are aware of this devastating disease, which has got zoonotic consequences. It is also caused by virus, which is the main location is the saliva of the animal. So virus infects the central nervous system of the animal. So this animal gets disoriented and has many other clinical symptoms, and finally this animal dies. Now, there are few different types of these viruses, but the most common one, which causes this rabies in animals or in human, because of the bite of the rabid animal, is the what they call Lyssa virus. Now, it can pass easily from animal to human, as I mentioned, through the bite of the animal. It doesn't have to be a dog. It could be a rabid cattle, which might have been bitten by a rabid dog. So those things can happen. But it's a devastating disease. Almost all the animals or people who get it, if they don't have a proper prophylactic treatment, they die. Now, it is almost every continent except Antarctica, and almost 90% of the rabies deaths are in Africa, Asia, and the Middle East. And in developed countries, this problem is very well controlled or does not exist. Estimate is that about close to 59,000 deaths happen every year in the world. Almost half of them are children. As you can imagine, that these stray dogs in many developing countries are very common. So the children height is very close to the dog too. So I think it's very easy access for the dog to bite the child. And there are some devastating, pictures of the children with injuries on their face and things like that. Now, in the United States or in all Western countries, the estimate is about in the U.S. 1 to 3 deaths per year. Now, there's no effective treatment once the symptoms appear in the affected animal or a person. There is a post-exposure prophylaxis that if a person or the animal is bitten, the person can get the series of injections to halt that, to stop that infection, and the person would not get those symptoms, and hopefully will be saved. Now it's very interesting to see that how rabies perpetuate the poverty. Some of the world's most poorest countries have this problem because, let us say, this post-exposure prophylaxis treatment, which is expensive, and many of these families, the communities cannot afford. On top of that, there's problem of dog overpopulation, and there are street dogs. So it's very easy for animals to get hold of, a child or other person who can bite, and then rabies, keep on going on. Now, rabies vaccination is the best way to prevent this problem, and currently, rabies alliances are all over, many organizations, including the WHO, FAO, and this one big organization called Global Alliance for Rabies Control. And I have put in their website, and I like their goal. They want to eliminate dog rabies in human death by 2030. So the third disease I would like to discuss is brucellosis. Now, this is caused by bacteria, and in large animals, it's almost like a reproduction disease. It causes abortion, retained fetal membranes, and in male, it's not that common, but once it is, then you could see the architis and the bacteria gets in the accessory sex glands. It is available or prevalent in most of the countries in the world. Primarily affects the cattle, pigs, sheep, and goats. There are four common types that we know that affect different animals, with the Brucella abortus, Brucella suis, which causes a problem in swine. Then we have Canis and Brucella melitensis. And it has got the zoonotic impact, and it causes what they call undulant fever. And many literature mention that brucellosis is an undulant fever. So it becomes really serious whenever this causes by Brucella melitensis. Now, in the cattle, as I mentioned, it causes abortion, and the main Brucella is Brucella abortus. It rapids, it spreads very quickly in herds, and many of the people get this infection because consuming raw milk. So raw milk from the animals, which are active brucellosis, animals, can cause this problem. And without going into too many details, there were some early on human abortions and many other clinical symptoms and problems. So back in, I think it was in 1960s sometime, that the United States, passed a law that all milk sold for public must be pasteurized. And it's interesting that some of our people, even in the United States, have fought with that idea, and they think that raw milk is more nutritious. So we have this raw milk controversy quite a bit going on in the United States. In fact, I had a separate video on that controversy, which I have put a link over here if you're interested in knowing more about it. So again, the transmission is by ingestion of these organisms, and brucellosis can get through mucous membrane and wounds and things like that. And I have had interesting experience, which I like to share very quickly, is that I was performing a C-section in a cow in Louisiana state. And this picture is not from there, but just showing the C-section is being done in Bogota, Colombia country, which I was there a few, 2, 3 years ago. So that Louisiana herd where I was doing the C-section, so I was about to, get the fetus out from the uterus. The farmer, the owner of the farm, came in and tapped my shoulder and says, Dr. Memon, I'm so sorry to mention to you that we are under quarantine. This farm is under quarantine because of brucellosis. So I'm so, sorry that I did not mention to you. You could imagine that, I got really alarmed because my both hands were in the belly, in the uterus of that cow, and trying to pull the fetus out. So I went through and took a series of antibiotics just as a precaution of that. So again, the clinical findings are mostly abortions, stillborn calves, weak calves if they're born, and the diagnosis would be on basis of bacteriology or serology. but the pure culture you can get is from the stomach of the aborted fetus. And there are vaccines available, at least in the United States. We have what you call the strain 19 vaccine available, which people use it. So the last disease of our consequences I'm going to touch upon is the avian influenza or bird flu. There's so much talk all over the world, especially in the United States. It's a viral disease, affects primarily birds, but their birds have also, one is low pathogenic and one is highly pathogenic. So sometimes this low pathogenic virus, birds may not show very many symptoms, but in the high pathogenic form, these birds get sick and they have different symptoms and they end up dying. Now these birds having this infection of this influenza usually have different symptoms, and one thing is that there is a decreased egg production, and that's part of the reason as we speak in the United States our eggs are about 3 to 4 times the price whatever it was a year ago. And part of the reason is that because we have so much disease here, avian influenza, that many laying hens have been discarded from the poultry farms. So the symptoms, again, whenever veterinarians see in the United States, they are required to report to the federal and state veterinarians so that they can come and confirm if it's influenza or something else. Now, human infection can happen through getting this virus through person's eyes. And at this time, as we speak, there have been some cases where people have gotten sick with avian influenza, especially those who are workers in the dairy farm. By the way, also from birds, it went to the dairy cows. There are quite a few dairy herds in the United States which are positive with avian influenza. So we have quite a bit debate and argument and stress going on because of this infection. And there are again different types of avian influenza. The one which you're talking about mostly here and especially getting in human is the H5N1 virus. And our United States Center for Disease Control and Prevention, CDC, has this interesting chart here, as you can see, showing is the poultry on the top and the wild birds. They're the main sources of avian influenza in the United States. And then, as you can see, from wildlife, wild birds, it goes to the cattle, so it goes on into the human, and even the domestic cats have gotten avian influenza. So I think, as I said, the situation is going on. So hopefully there will be some good resolution very quickly. So in recent human cases, as I mentioned, so current is a public health risk is low. The good news is still there's no human to human transmission. But again, we know that how these viruses can mutate, and that was the concern and scare is in the United States. That if this virus mutate and then make people susceptible, we may have another problem like we had COVID-19. But let us hope nothing will happen. But this is where we are with that. So with that, I'm going to stop this video. And if you've got any questions or comments, please feel free to ask on YouTube channel, and I'll be more than happy to respond. Until then, I'll wish you well. Bye-bye.